Welcome back to Our First Century, a podcast celebrating 100 years of TA Loving Company.
I'm Ty Edmondson, CEO of TA Loving Company.
And I'm Krista Davenport, Vice President of People and Culture. In today's episode, we're diving into the world of healthcare construction. For us, healthcare construction isn't just about bricks, steel, and schedules. It's about creating environments where care can happen, lives can be saved, and communities can thrive.
In this episode, we're joined by Kyle Marek, CEO of Carteret Healthcare, and TA Loving Company Building Group employees Brett Bond, Josh Price, and Leland Flanagan.
This is episode 10, Building with Care, a look into healthcare. Let's dive in.
Kyle, thanks for being with us today. We really appreciate you making the effort to be here. I know you're busy, and I know carving out that kind of time, it takes an effort, and we do appreciate it.
Thanks for having me.
On your recent project, what made TA Loving Company stand out, and what made you select TA Loving Company?
So to be honest with you, we kind of reached out to TA Loving, had them bid on the job. And I think it was just the interpersonal relationships, meeting with them and the way they kind of interacted with our board, with our staff. It was just a huge difference. I think they wanted to be a partner, and that's kind of what we want to do.
Yeah, that's what we really talk about a lot around here. We were based on relationships, and that's what we focus on. So that's good to hear.
Yep.
So you chose us because of relationships. What's it like to work with TA Loving Company?
I mean, how much time do you have? No,
as much time as you have.
No,
Kyle.
It's actually been great. I think all of our staff and myself, we've built long-term relationships with them. And that, to me, we can build on forever. I think that's huge.
What does TA Loving do that really stands out to you that makes us a good, strong partner?
They're honest. I mean, they kind of bring everything to you, whether you want to hear it or not. And that's kind of what we like to do. And we're just together on it, and we figure out the best way to get to the end.
Yeah, it is so important to be transparent.
Yes.
Because when you can solve anything, but when things are hidden, it's really hard to determine an effective plan.
Exactly.
Kyle, from your perspective, what makes a project be successful?
Well, I'm always going to say no change orders, but that's like literally impossible. I think, just kind of being on time and it being successful, right? Coming to the final end. There is no perfect project. Everybody expects a perfect project. They don't exist. You're going to have bumps in the road. I think having the right team on board on both sides and working together to get to the final end.
Yeah, I agree. They're all going to have problems, and we've got to work through them together.
That's right.
What's one thing about the Carteret Healthcare Surgical Addition and renovation that you're especially proud of?
Honestly, I think what it brings to our community, kind of what we talked about right before this and jumping on the air is, it allowed us to expand our room size to be able to get robotics. And now we're able to bring that to a small community rural hospital, and our patients don't have to travel for it. So that's a huge benefit to the community.
Can you talk a little bit more about those robotics? I know you said we were talking about it before. We want to make sure everyone else is up to speed.
So we were, with the room increased size and all the new area changes and everything, we're now able to bring a Da Vinci 5, which is the state-of-the-art robotic general surgery, breast surgery, a little bit of everything to our community, which we weren't able to do previously in our current ORs.
So the projects we build matter.
They do. Yes.
I talk about the things our company does as being quality of life projects, and they're essential.
Yes.
And that's a great example of what that is and what that means.
Following along those lines of what we do is essential, you all treat cancer patients, you treat children, your facilities serve very critical needs. How does the building itself support your mission of care?
Again, I think it's bringing to the community what they don't have to travel for. I mean, it's a huge burden on not just the patient, but the caregivers. When you have to travel an hour plus, 2 hours plus, being able to bring that care to a local community is huge.
Having an acute or a chronic need that is straining your life is enough pressure in and of itself. than to add the travel and everything else that comes with the travel, accommodations. How are you going to handle food, meal prep? It just adds so much more stress to an already stressful situation. So it really is an important part of the process for people to be closer to home and also closer to their community and have support from other people who can help them as well.
It is. And believe it or not, it's actually truly helped us, bring higher end physicians to the community, because physicians like to see that you're investing in the facility and the patients.
Yeah, that was going to be one of my questions. What are you seeing as you build these facilities with the new equipment? You are able to bring in people
Yes.
that may not have come otherwise. So that's great.
Do you find in that case that it's easier to recruit, or do you have more people seeking you out?
It's a little bit of both, right? So you get more people seeking you out, which gives you a little more chance to pick and choose the perfect one for the community.
Mm-hmm.
That's a really good point.
Yep.
So we just talked about everything you're doing being critical and being able to serve the people in your community. How have the projects with TA Loving Company improved patient outcomes, staff workflows, and or family experiences?
So in the most recent one with the OR, I think, just if you saw our old ORs, to be able to just see the difference with the patients and their families where they're waiting to kind of be in a better situation. The new cancer center you guys are building for us is a huge, they're kind of in roughly about, I'm going to say 10,000 square feet, and we're going to a 30,000, 40,000 square foot building.
Wow.
So just the patient flow, the workflow for the staff is huge.
Yeah, absolutely. We just recently did a podcast on K-12, and we talked about how important that work is to the communities, and you are highlighting the importance of this work with hospitals and health for the communities as well. Facilities don't just treat people, they transform the community, as we were just discussing. What impact have you seen in the upfit of these buildings beyond what we've already talked about?
I think honestly, it takes a small rural hospital and it kind of elevates it. When you start seeing these new large facilities and what we're investing into the community, it kind of gives you the comfort to the patients and the community that we care about them. And that's been a game changer. I think if you look in the past, everybody thought Carteret Healthcare, Carteret General Hospital, what it used to be, it's just this kind of small podunk, I want to say, or rinky-dink hospital. And now we're really transforming it.
Yeah, a quote that some people struggle with is your perception is my reality.
Yes.
And you just talked about that. Their perception of you is the reality that you have to live with, and now you are changing their perception.
Yes.
How has the Carteret Healthcare Surgical Addition and renovation helped you reach more patients or provide better services to underserved people within your rural community?
So again, I think it's being able to treat the more acutely sick people, having those larger rooms, allowing us to get more robotics and allowing us to have a better patient flow. We're able to treat more and more of those patients.
What's changing in the way healthcare facilities are designed and used, and how do you see construction firms like TA Loving Company playing a role in that evolution?
Well, I'd be wrong if I didn't say they keep getting more and more expensive to build. I think the partnership we have with TA Loving, they come to the table and help us look at ways that we can value engineer that out. And that's huge. Finances on both sides, both on the construction and on the healthcare side, are a challenge. Having a partner that helps you get through that and find ways to do the same thing at a more cost-efficient way has been a huge benefit to both our hospital and to the community.
Yeah, that is a big part of what we do. Yep. Because everyone is stretched for money.
Yes.
But the need's there.
It is. The needs aren't going away, but the dollars are.
Yeah.
So, being able to partner with a good group like you guys at TA Loving has helped us get through that.
Well, good. That's great.
One of the topics that we haven't discussed yet that I've actually experienced touring your hospital while it was being built is the challenge of doing an addition or renovation on an existing structure where patients are being seen. Can you talk to us a little bit about that?
So that is always a challenge. And I think the good thing about it is the staff you guys have and you bring on board, they build the relationship not only with us as the owner, but with the patients. So they interact with them and they're willing to help. If they see a patient lost, most of them know the facility. They walk them around, show them where they need to get. So having that on board and constantly keeping it clean, making sure from an infection control standpoint, we're on top of it. We've been through some joint commissions and you guys have done excellent with that for us. I think that's just a huge benefit, being able to have somebody who's willing to work and they kind of understand that the patients are there because they have to be, not by choice. And they help them get through whatever they need to.
Yeah, that's a really good point. Plus, great example of you've got to be working with everybody there.
Yes.
Because we impact everybody there.
Yep.
And it really is an interesting experience to be standing in this OR that's a work in progress and to know that there's someone in the OR right next door who is actually undergoing surgery. And to think about, like you said, infection control, odor control, everything else that goes into it to be able to do the work in the timeline that's needed while also continuing to serve the public. Kyle, if you had one message to other healthcare systems or universities who are planning new healthcare facilities, what would it be?
Choose the right partner. I mean, honestly, the costs are always going to be there, but I think if you have the right partner on board, you're going to get through it at the end of the day and you're going to work together. If you go in there as an adversarial type situation, nothing really gets accomplished. So I think partner with the right group, you're going to make a successful project.
Yeah, absolutely.
Yeah, I agree. Projects, especially the type of projects we're doing for you all, they're difficult. They're going to have problems. They're going to, you're going to have something you got to deal with that was unexpected. And to have that ability to work through it, work as a team, I think is what it's all about.
Yep. The team approach always makes a huge difference.
Yeah.
If you're not working together, you're fighting each other, you're not going to get anywhere.
Yeah, I agree. Kyle, tell us about the history of TA Loving Company working with you all. And when did it start? And talk to us about that progression.
So I think it started in 2016. You guys bid and successfully won a job for our central sterile renovation. That initially started as a project that was going to be central sterile and OR. Working with you guys, it was kind of determined it's probably best to kind of separate that out. As we talked about earlier, you guys said, how do you do this kind of construction with patient care going on? So I think, partnering with you guys helped us kind of realize this is the smart thing to do. Let's separate this out, get one part done, move on to the next. So we did. We moved on to the OR renovation and expansion. From that, you guys helped us along for the radiation oncology expansion. And now you're helping us build the new multi-specialty clinic with the freestanding ED, ambulatory surgery center, MRI, and on top of that, it's going to be primary care.
Yeah, that's a great example of teamwork, a partnership, and a lot of trust and a lot of relationships that are in place to make all that happen.
Yep.
The higher the trust, the faster you can go. And
Yes.
the less you have to communicate. Communication is always important in any partnership. And the more experience you have working together, the more you know, and you can kind of feel out how each group is going to feel about something. So it just makes it a lot easier to get to this shared end result.
And I'll tell you, from the first project we did together to now, I think the relationship we've grown to have, we work together much better. You know what I mean? It's each project you learn what you can do. And I think kind of the after action that we do together as the contractor and as the owner, we meet after every project. What can we do better on the next project? And we try to accomplish that with each upcoming project.
What questions do you have about TA Loving Company?
I mean, I just think, honestly, is my biggest thing is your continued commitment to rural healthcare, because that's kind of my love. That's what we care about. Not that other healthcare doesn't exist, but that's kind of what I live every day. And I think your guys' commitment to my community has made a difference. I think, along with the partnership, just kind of, a lot of your staff interact with our staff's kids. Like if you have to bring them to work or it's late nights because it's a cutover or something like that, to me, that just means a lot. They'll interact with them. They've given them hard hats, taken them on tours. That's a huge difference.
That's a great story.
And we do talk about focus on family here. That's something else that comes up. I talked about we do work that is critical and essential, and we focus on relationships, and we are all together working together as a family, as an effective team. And it's great to hear that branches out beyond just TA Loving Company and also with our partners and clients as well. Kyle, what else should our listeners know about construction in healthcare?
I think, again, going back to is, you got to find the right partner. Honestly, it's all about partnerships, teamwork. If you can't work together with an owner and a contractor and, the engineers and architects, having that constant communication, teamwork, and getting to the final project, the finish line.
Mm. It always seems so far away
It
until
does.
it's not.
It does. And then before you know it, you're having a grand opening, you're like, oh, we were not ready for this.
Right. Kyle, what's something that people often misunderstand about construction and healthcare?
I think the biggest thing that people misunderstand in construction and healthcare is how to keep day-to-day activities going and keep the patients from not realizing you're doing construction. And I think, kind of having the right people on board and working through that and understanding that every noise, every beep, every block being hit, every nail being hit or anything like that, how to keep that so the patients don't know anything's going on. And at the end, they just see the final results.
Kyle, tell us a standout moment in your experience that really identifies the success of a project.
So for me, being at Carteret Healthcare for a little over 26 years, we've seen a lot of different contractors come on board. We brought TA Loving on board. And to me, the fact that with you guys and your relationship with both our organization and our community, that we've continued to do projects with you guys since 2016, to me is a defining moment. To know that we have that relationship and that communication and teamwork, and not only with just us as the owner, but with our board. A lot of your team interacts with our board on a day-to-day basis, and being able to continue to want to work with us.
So you just said you've been at Carteret for 26 years, and you talked about being passionate about healthcare in rural communities. How did you get to Carteret Healthcare, and what made healthcare a passion?
So to me, honestly, I started in kind of a different way in healthcare. I started in the technology side of it. I'm kind of a tech geek on the backside. I've had the luxury of being at Carteret, like I said, 26 years, and learning from a lot of great people and the difference you make in a community. As you get older, you start to realize you're going to need more and more healthcare. So to me, that's kind of been the driving moment for me.
I've had that realization too.
Yeah, the older we get, the more you use it.
Kyle, we talked earlier about the growth in our region, and it's really incredible. What from a planning perspective and your career path over the past 26 years and kind of preparing for all that, what are you having to do to facilitate that growth?
So honestly, the big difference we've seen at Carteret is, when COVID hit, typically everybody shut down and everything like that. At Carteret Healthcare in Carteret County, everybody that was a second homeowner decided, why not live at the beach when you can work remote? So we saw a huge influx come into our community. We're a 70,000 community member. And on the summers, we'd see 300,000. We haven't seen a census since 2021, I think it was, or 2020. We're thinking it's every bit of 100,000+. So we're having to grow to meet the needs and just having to expand. We're expanding out in the Western community that's the next largest growing community within us, and just trying to keep up. I think that's been the biggest challenge. We're at the point we can't grow fast enough.
What do you think are the differences between healthcare in a beach community versus healthcare in a city?
So the healthcare in a beach community, I think the biggest challenge is making sure we have all the needs that are for that community. We can't be everything to everybody. We want to make sure we can treat a majority of your needs. Getting all the specialties. We don't have access to every specialty, but knowing that we can treat you and stabilize you and get you to where you need to be.
Kyle, thank you so much for being with us today. Again, I know it's a time commitment, and I know you're busy because you've got a lot going on. But TA Loving Company, we greatly appreciate the relationship and the partnership, and look forward to the projects we're on now and future projects.
Well, I appreciate the opportunity to come up here and talk with you guys, and appreciate the partnership and your team.
Thank you, Kyle.
Thank you. Brett, Leland, and Josh, thank y'all for being with us today. I know it takes an effort to be here, but I think this is really important that we we talk about all the great projects that we do on a regular basis. Before we get started, can each of you tell us a little bit about yourself and your experience in building healthcare projects? Brett, let's start with you.
Yeah, so Brett Bond, I'll start by saying I've been a part of the T11 family long before my career started. My dad's a going on 35-year superintendent for us, so I was kind of born into it. I remember dating back to the 90s, him starting in healthcare right here at Wayne, and traveling, doing healthcare construction. But I say all that. I started with the company right after my freshman year, 2006. Very first project was East Carolina Heart Institute in Greenville. Fairly confident it was probably one of the biggest projects in the state at the time. That job, it was large enough to take me through all of college. I came on in 2010 and worked in the field for about 3 or 4 years. Then switched over to project management type on the hospital side, and been doing it from the Triangle to the coast ever since. Always been on some shape or form a hospital project. So it's been good. Some days it's crazy, but all in all, it's been rewarding over the past 19 years now.
You know, it's always great to hear stories like yours. We've got so many examples of that in our company, of families and generations and folks that have been with us their entire career and their entire life, really been involved with the company. So it's a great example.
Yes, sir.
Leland, tell us a little bit about yourself.
So my name is Leland Flanagan. Been working here for 6 years. Started out as an intern back in 2019. Graduated from ECU doing construction management. My last 2 years of school, I was working part-time with T11. First project was Vidant pediatric pharmacy. So we did that, and then been basically in Carteret healthcare since then, about the last 4 years, doing surgical projects and now in oncology. So I've really fell in love with doing healthcare construction, just the complexity that goes into it and the problem solving we have to face every day. So,
your past includes working here as an intern. Talk a little bit about how your internships helped in your education.
So the internship was really made me who I am today. I spent 2 years working 30 plus hours a week around my class schedule, and getting to learn from PMs and superintendents with the company really gave me a huge advantage. Starting now as assistant superintendent versus someone just going to school and not getting that experience.
Yeah, I agree. I think that's such a great experience to have, and it's nice that you had that opportunity.
Yep.
Leland, talk a little bit about working with Steve Bond, Brett's father. I know you had some experience with him.
So I've been working with Steve the last 4 years. I was this assistant superintendent when I arrived at Carteret, and he really taught me how to be a superintendent. He really taught me how to prioritize the project and how to manage the day-to-day operations and really start to see the future and see how it all comes together. He's really one that instilled a lot of the qualities that I use to manage jobs today.
Well, that's great. Josh, tell us a little bit about yourself.
Sure. My name is Josh Price, project manager. Been with T11 Company since 2017. Steve has also taught me a lot about how to be a project manager. I think he's helped a lot of us out. My first healthcare project with T11 was over at Vidant Beaufort Hospital in Little Washington, and it was a complete infrastructure upgrade, emergency room addition. It was a little bit of everything, and it was trial by fire. It was a great learning experience. A lot of hands-on time. I was full-time on site as a project manager, and just the experience from being there every day and seeing how things work and the way we do things was something that just got me started on the right track and on the path that I'm on now.
Brett, TA11 companies help build hospitals where real lives are saved and changed every day. What's a healthcare project that stuck with you personally and why?
There's a few. I mean, with all the campuses that we work on, in some shape or form, we've got family, we've got friends that that have some type of care. Some days may be the best days, some days may be the worst days. You never know. But I'll say particular, I mean, UNC Wayne, we did a large surgery addition and renovation right here at our local hospital, right here in town. That surgery center, it was built in the 60s. So we went in 2017 to start that. But it was about a 3-year project, 100,000 square feet. And it was just a major undertaking. We added 14 ORs onto that building, all while keeping things going, keeping patients going. And it was just a big 3-year commitment for myself, for everyone involved. But I say it's the most memorable project-wise. It was the most technical I've been involved with, most complex, most challenging. But it's memorable because it's right here in town. My kids were born there, had procedures done there. Family taken care of there. So I mean, that's been ultimately why it's been the most memorable for me. But like I said, that's across all of the healthcare campuses we work on.
Yeah, these projects we do in the healthcare market especially are so critical. I mean, it's not an optional thing. They've got to be there, and they've got to. And when we're there, we have to recognize that.
Oh yeah,
and it's got to be business as usual, no matter what we're doing.
Sure.
absolutely.
So
yeah, they affect us.
Josh Cecil Baker, former superintendent here from years ago, noted in the book, in our history book, I don't know if this building will be the one where some cure will be discovered. How does it feel to be part of projects with that kind of potential impact?
So I thought a lot about that question when we got that kind of as some things to think about. And I was thinking of just kind of how grand it would be if there was a big breakthrough at one of these facilities. And I think I was thinking about that the wrong way. Where we are every day, there are breakthroughs with everybody. Somebody goes in, they're sick, they're trying to figure out what's wrong with them. Maybe they've tried a few other places and they've found a doctor in the right mix of people and facility that they give them the relief they need or the help that they need. And that's something that's really, I would lie if I said that there's not a lot of pressure in that, because we're doing these major undertakings in what are 99% of the time occupied facilities.
Mm-hmm.
And what we don't want is for that person to come in on a bad day and us make that day worse. We want to make sure that they get the care and the attention that they need, and that we're not distracting staff. We're staying out of the way. They're not laying there listening to us outside beating and banging on the side of the walls. And it's a major undertaking, but it gives you a big sense of pride when you can come in and you want to say when you can come in and pull it off with a good team, and that none of those patients know you're there. And I think that's what we try to do.
Yeah, I agree. It's that's a really good way you said that. Everybody there is their lives are changing.
Correct.
Mm-hmm.
I mean, they're being impacted.
That's right.
Yeah, we're
Good or bad.
we're in pre-con now on a women's bed tower, birthing center, labor and delivery, and we're going to be doing some major work. And the only thing that's going to separate us from a woman with a newborn is sheetrock and metal studs. So, like I say, I'd be lying if I said that there wasn't a lot of pressure, because there is a lot of pressure. But when things go right, it's very rewarding at the end of the day to know that they've come in and had the experience they're going to have, and that we did not impact that at all.
Yep. Very challenging, but very rewarding.
It's challenging.
Yeah.
Yep.
Leland healthcare construction isn't just about walls. It's about life safety, infection control, and nonstop operations. Can you walk us through what it's like to build within a functioning hospital?
There's definitely a lot of communication involved, more so than a normal construction project. We have to make sure that the facilities staff, the nurses and doctors of that particular work area, and our subcontractors know what's going on. They got to know the plan. So we have to over communicate everything to make sure everybody's on the same page at all times. Something as simple as a electrical shutdown for tying in a light circuit. we got to cut off the lights in a PACU, we have to make sure that PACU staff knows, the facilities know, and we do it at the right time to where we don't cut the lights on them, during the day. So everything is definitely planned and scheduled in a way that we have minimal impact to their operations. It makes it very challenging, and we have to put a lot of thought into every step of the job, all the way from demo to the final punch, how we impact them in every way for noise, vibration, any odors and fumes, stuff like that. And the main thing is making sure our life safety routes are intact at all times in case there happens to be a fire or anything else.
Kyle Marek, he talked about how you all do a great job of explaining what's going to happen, what's going on with everyone.
Yep.
It's not just one single point of contact. It's everybody you're impacting, and how everybody's got to know the plan.
Yep.
And then you've got to work the plan. And it was good to hear it from him, from his perspective, because he gave a really good example of that.
Yeah, we try to avoid surprises because typically if there's a surprise, the doctors and nurses will call the facilities and they'll call us, what's going on. So we really want to avoid any type of surprise, but they do happen and we have to be prepared to react to them. So that's another thing, is being ready to react to a problem that may pop up. For instance, one time we had we were demoing ductwork and we hit a communication line for the intercom system. Wasn't really avoidable. It was just, things happen. And, we had to jump on that. We had to call somebody in and get them to fix that, because that's where they call their codes on, which is something that we have to think about. We sat down with everybody and said, all right, guys, in the future, we got to really pay attention to any low voltage. So something that small can impact the whole facility. That's how it's challenging.
Before you asked the question, Leland and I were talking before we walked in here, and we were talking about that subject. And he's being modest now. I mean, he could talk for hours and hours about what he does on the day-to-day basis. I mean, he looked at me, he said, where you want to start?
Yeah.
That's really, what he does, and he's got to be really well. I mean, him and Josh are working together, but I know how well he's doing, and our superintendents are our front line for that.
Yeah, that's exactly right.
Well, and in addition to be prepared for anything, we also have to be extremely flexible. So you develop a ironclad plan, everybody buys in. Well, guess what? There's a traffic accident across town. That ER that's supposed to be closed, or I'm sorry, not the ER, that OR that's supposed to be closed, all of a sudden, guess what? They need 2 of them back, and we're standing there ready to go to work. So it is also a lot of flexibility and a lot of give and take with the owner. I mean, we get in and work some hours that are pretty strange. Keep these guys really stretched out, but it's a I don't know where I'm going. I'm just talking.
No, it's just healthcare construction in general. I mean, like I said, he could talk for hours on it. We all could, just on the stories and the things we've learned and how you, like you said, you adapt to construction in a hospital.
Yeah, it's a good word, how you adapt. Yeah, that's a good summary, because you have to. Everything's going to change.
Exactly.
Well, Brett, you mentioned lessons learned. Maybe each of you give us an example of key lessons you've learned recently or over your work time.
I mean, as far as a specific one, I mean, there's so much. Leland talked about the plan, the risk assessment, having that specific plan lined up, and where you're talking to everybody about it, and you get so many people involved. We have more meetings about planning a simple shutdown for a night to shut down a steam line or air handler or something like that, and just learning how important those meetings are early on before a 8-hour, session for a shutdown happens. We may have met for 40 hours on it, and just that pre-planning is the biggest lesson learned overall.
Right.
So,
Leland, what comes to mind?
Kind of ties in what Brett was saying. The pre-planning is huge, and just making sure that the owners really know what we're about to do, how we're about to do it, and when we're going to do it. I mean, every aspect of that plan to ensure that nothing goes wrong. I mean, that's the big part, is the communication.
Yeah, I guess my biggest lesson learned would kind of piggyback on that is, I mean, you really have to over communicate, and we take it for granted. We're walled off in a construction space, and we're dealing with folks that are doing construction work in these places all day. So when we go to communicate plans to staff, and when Leland and field staff are walking, the nursing team through what we're going to do with tape lines on the floor and showing them where walls are. I mean, we really take it for granted that everybody kind of speaks our language. So it's a situation where you over communicate, you over meet, but you do that just to make sure that everybody understands the plan and what's going to be impacted. And, unfortunately, what could go wrong, so that we can prepare for that, but so the facility can react to, because they've got a list of things. So you over plan, you over meet, and then you execute. And I think that's the biggest lesson learned for me, is that this healthcare projects can't get by on a 1 time a week meeting. I mean, you're meeting daily, sometimes twice a day, sometimes meeting to talk about the meeting you're going to have for the meeting. So that's my biggest lesson learned. You can't be complacent and just think that everybody knows, knows the language and knows what we're going to do the way that we do.
Yeah.
Yeah, I'll just speak about one more thing as far as lesson learned with healthcare construction. Another big thing is really typical, non-healthcare job. A painter can show up and say, all right, we'll go paint those walls over there. You can just send them to the building. Well, healthcare, you're having to really escort them through the hospital and make sure they know where to go. They're not using the owner's bathrooms, or they're not going anywhere they're not supposed to go, and they're also not making a mess. That's pretty huge as far as just having full control of your project and making sure we're not impacting everywhere else in the hospital. Make sure you're not going to the cafeteria or wandering around. It's really keeping our whole project and where we're supposed to be.
Exactly. Well, Josh, the Carteret Healthcare Surgical Addition and Renovation Project included 5 new ORs with an aggressive project schedule. How do you manage schedules and the scale of a project like that without disrupting patient care?
A lot of meeting, a lot of hard conversations. We were, little background on that project. We constructed those 5 ORs in that addition in a little under 9 months. And the reason for it is it was lost revenue for the hospital. We had to take ORs down in order to build these. With that being said, the existing ORs, we were in one of those situations where the only thing in between us was a layer of brick, sheetrock, metal studs, and eventually the brick came down. So they were doing active surgeries on the other side of walls that we are building this new addition on. So there was a lot of communication, a lot of planning. A lot of it was getting the subcontractors to buy into what we were trying to do. I mean, we all sign contracts with schedules, but until you're out there and you're figuring out how everything goes together, and we have phasing plans within phasing plans. I mean, it took an effort, a gigantic effort with our field staff planning the work. And then, the back of the house, things that we would do as far as making sure that change orders are addressed promptly, keeping everybody motivated to try to get through this and make sure that financially everybody was in a good space on it. Weather wasn't really an issue, so it really was more of a case of motivating.
I mean, I'll jump in on the schedule aspect of it and what we do with hospitals. And that schedule, we always say, is one of our most powerful tools as a CM in what we do, whether it be quality, safety. But on the hospital side, that schedule is relayed. We developed the relationships with the core facilities people and the core people that we're building for, like the surgical director or something like that. But that schedule is relayed to so many people across that campus. And on the accountability side of it, once it is distributed to the thousands of workers that are on that campus, if they have to bring it back, then that's what just holds us accountable across the board. And it can be something as an overall schedule, we're going to complete ORs on this date, or it can be a schedule of we're going to shut down this parking spot on this date. It doesn't matter how big or small that schedule is, the impact it gives us the accountability to the owner to do what we have to do.
Yeah, you know, a couple of good points y'all have made is we've got to over communicate. I mean, we got to talk about plans, got to explain plans. You got, you know, it's talking about it at a level of detail that you probably wouldn't want to have to do, but you have to just to make sure everybody understands. And then the team members that we bring with us, you know, your point about bringing quality, our quality subcontractors with us that understand what goes into that kind of work. I think those are two really good points.
Well, and those contractors, they also understand that once we get one of these plans and it's locked in and it's been distributed, there really is no going back. So we don't, fortunately, we don't get those calls of, well, hey, you know, this guy didn't show up, or you know, we didn't get, this material didn't come in. I mean, they know that when we pop one of those on the schedule, there really is no turning back.
Yeah.
Mm-hmm.
So
Yeah, difficult part about staying on schedule and healthcare renovation is all the unknown factors. You know, you find a lot of those after a demo. We'll go in, demo all the walls, and we'll find a 4-inch plumbing main waste pipe that wasn't shown in the drawings. You know, so that transfer of information with RFIs to the design team and getting that information back, and then doing whatever work it takes to move it or whatever it may be, that makes it tough to stay on schedule. Like, there's a lot of problems that pop up, and that makes it interesting. That's for sure.
Yeah. Brett, what role does innovation, whether in design, project management, or materials, play in your approach to healthcare construction?
So I mentioned being here 19 years now. I mean, ever since I've been here, I've seen there's a constant demand to compete with upgraded technology within the hospital, not necessarily on our side. And what we see is, whether it be a linear accelerator, OR equipment, MRIs, there's always a constant need to evolve from the provider side. And I'll tell this story. My first project out of college was a linear accelerator in 2010. I went back there in 2019 and replaced it. So that was just an example of what that. And in 2010, it was the cutting edge linear accelerator for cancer. But with that becomes more complex construction on our side. All the infrastructure that feeds these major machines has become more and more complex. And we talked about renovations being a big part of what we do in existing hospitals. When we go in, we can't make the building any bigger as far as the space that everything has to fit. So, and these guys will tell you, when we go into a hospital and you see what you see, you know, you see the ceilings, the walls, but what you don't see is just the amount of infrastructure that is above a hospital ceiling. So with that, on our side, virtual construction has become, you know, a big part of what we do. If you don't have it now, then you're kind of falling behind. You have to have it, but we've got to put so much materials and, again, infrastructure in such a tight place these days. Having that virtual construction before we even go in there to make sure it all fits is becoming just more and more of a norm. And I'll say it wasn't a norm, you know, 10 years ago while we were doing it back then. But the healthcare is getting more and more complex. The machines are getting more and more complex, and so forth is construction on our side. So that's a big part of it.
All right. Leland, TA11 Company has built rural hospitals and major health systems alike. What's something people often misunderstand about what it takes to build a hospital?
I would say the difference in the quality of the materials and that goes into them and the testing requirements. Everything we do, we have to make sure it's going to last 50 years. You know, we got to think about going above and beyond pressure tests with all of our piping, with for med gas, the third-party testing for electrical, for every startup of a air handler, for instance. Everything has to work pristine, and some things are life or death. So we have to go above and beyond to meet those expectations. That's a lot different than any other type of construction I know of.
Yeah. Josh, with so much regulation and the requirements Leland talked about, how do you stay ahead of the curve in this type of work?
I think the best way of staying ahead of the curve is to to participate in, trade conferences. Go see what's new, what's coming up. You can learn a lot. We learn a lot from our peers in construction at these conferences, but we also learn a lot from hearing owners' presentations on new things they've tried and kind of tips and tips and tricks of the trade. We also we learn a lot about what doesn't work, and it gives you a chance sometimes to take a look in the mirror and go, oh gosh, if we're doing that, we probably need to start needing to change course. But like Leland said, that with the level of technology and innovation in these facilities, it's constantly changing. The commissioning on all this equipment is a gigantic deal. It can be a schedule killer. It can really make or break the project, especially when you're getting to the end and you've got a team that's ready to move in and start using the space. So I think the way that we stay on the cutting edge is to participate in groups with our peers, get feedback on that, be really active with design teams, especially early on when they're working with the owner to determine what their equipment's going to be and what those requirements are. Any of those items that can be chosen early in the process helps us on the back end make sure that we're coordinated, make sure that our trade partners are prepared to do what it's going to take to service and provide those connections for that equipment. I think all of that kind of goes towards making it a successful project.
Yeah, that's a great point you made about working with the designers. And then, Kyle Marek made the point of how we're helping him with future projects, giving our advice, giving our input. So that's kind of ties to what you're getting at. Leland, how do you define building with care?
I would say really looking at the project as a whole through the owner's lens first before our own. We're going in their facility and really, at the end of the day, we're being a nuisance. We're shutting down areas, making noise. Everybody that's working around us has got to go out of their way for a certain period of time. So trying to look at the project through their lens is the best way to build with care. I really think that learning how they operate from, like when we renovated the surgical department at Carteret, we went all the way from day surgery, prep recoveries, all the way to the new OR. So learning how the patient goes from the pre-op to surgery to PACU to recovery and what that looks like, we have a better understanding of how we need to work around them. And so I really feel like building with care is understanding their operations, understanding how we can avoid impacting them, and really putting patient safety ahead of the schedule and everything else.
That's
Brett, the impact of hospitals like Carteret or New Hanover or Vidant go far beyond the buildings we build. What are the other impacts that you see as a result of the work we do in expanding these facilities?
The impacts, I'll say even locally, most of the communities we go to, these hospitals are the largest employers in the communities that we do go to, just providing, for the economy right here, local in town. I know UNC Wayne is the largest employer we have here. Also, the impact it has, as we evolve these campuses, we're evolving each other. Leland is a good testament to that, but our team just continuing to evolve and grow with these campuses has been a big impact for us. And then ultimately just the actual providing patient care. The better that gets, the better we all are. And that's kind of the main goal we always got to keep our eye on is we do it to care for just patients in general.
Yeah, that's a good point. I like what you said about the opportunity we're providing from an employment perspective for outside the company and inside the company. Yep. Good point. Brett, what would you say is the TA Loving way when it comes to healthcare construction, and how has it evolved over our past 100 years?
I would say it has evolved, and you've seen kind of a recurring theme here is patient safety's always just been the number one thing that comes to mind. but that has heightened a lot ever since my time here. Starting back when I was in college, that has really got more and more involved, more and more complex, and it's all ultimately for the safety of the patient. All the regulations you mentioned, all the paperwork that goes into it, we have really evolved in how we do that. We've really evolved on the technology side that I spoke of with the virtual construction. But as far as the T11 way, I always try and think of the core values we always talk of them. Sometimes people ask me, what is your favorite core value of the company? And I always say the integrity. Most time that means that we do what we say we're going to do. T11 does, and I also just consider just integrity is you do what's right. You do the right thing. And I feel very confident that any hospital campus you see us on, that's the main thing we're trying to do. We're trying to do what's right. Ultimately we want to beat the schedule. We want to meet our financial goals. Of course, we want to be safe, but none of that matters if we don't do what's right by the healthcare providers that are working there, and ultimately the patients that are being seen there. So just doing what's right, I would say, is our way, and doing healthcare construction. And really, once we learn that, all the other things will fall in place, because you can't be successful on the schedule, the financial side. You can't be successful on any of that if you don't keep the patient's safety in mind and do what's right by them. So I would say that just having integrity in what we do is our T11 way in healthcare.
Yeah. Same question, Leland. We just core values are up on that wall there. Pick one and talk about it a little bit. What means something to you up there? I know they're all important to us.
I'm definitely going to say teamwork. I mean, it takes a team. There's no one person that can go into any healthcare facility and figure out how to do it. It has to be working with the owner, the design team, trade partners. It's teamwork.
Josh?
So I would say what T11 way, and I think it applies to really everything we touch is client advocacy. We go into these healthcare facilities and we do a really good job of documenting what's there. A lot of times when we start a project, we're at the mercy of whoever did the last set of as-builts. You never really know what you got until you start opening up walls and opening up ceilings. Our folks do a really good job of exposing things and bringing to the owner's attention items that may be an issue in the future. It's not something just, hey, just we see this, we want to make sure you know about it so we can go ahead and address it while we're in here. Or, hey, we've walked these risk plans, these traffic plans, phasing plans with the users, and there was a point of view that may not have been thought about. We want to put that in front of you. So a lot of times we'll find ourselves as a link between their departments of their organization. But I feel like we are advocates for the client, and again, that goes back to patient safety. They don't want anybody leaving that facility and getting sicker or having some barrier to better health because of a construction project. So we are always looking out for what's in the best interest of the client. We're willing to work through some pretty hard situations, keep the schedule moving on a handshake. That's just the way we've always been with our clients, and I think that's appreciated, because at the end of the day, we can both look at each other and know that we've treated each other fairly and we've acted in the best interest of the project.
Yeah, I agree.
One of the biggest differences in healthcare construction is how clean we have to keep our work areas. The biggest challenge is figuring out how to get materials in and trash out. Every trash cart has to be covered with a lid. We have to constantly clean the wheels on them so we don't drag it through the corridors. I've had to make everyone wear boot covers before we enter to a work area. So it's constantly maintaining sticky mats and negative air pressure throughout the whole renovations.
That's great. Good point. Complexities you don't necessarily think about.
Yeah,
That's right. I mean, it's a job site that you wipe your feet when you come in the door, and you have to wipe your feet when you go out the door.
Yeah.
So,
Like you said, you've said, if you contain your footprints inside the job site, it won't make them outside of the job site.
Yeah.
And I say that just because footprints are a big no-no, put it that way, in a hospital from construction. So,
Again, I want to thank y'all. I mean, it's been a great discussion. Hearing you all talk about it, hearing Kyle's perspective on it, it's really been informative. And thank you all again for your time and being here today.
absolutely.
Yeah, thank you.
Thank you.
Thanks for joining us today on our first century. If you've got questions or ideas you'd love to hear on the podcast, send them our way at podcast@taloving.com.
If you've enjoyed today's episode and you want to hear more, please follow along for future episodes and take a look back to past episodes as well.
And remember, it's a great day to be in construction.